So cervical cancer came into the news, we all know,
Yes.
and for the good, let's say. So cervix is a part of the uterus. It's the mouth of the uterus, as we call it. Cervical cancer is very, very common compared to ovarian cancer. But the best part about cervical cancer is that it can be detected early. You can detect it early and you can prevent it to a large extent. So cervical cancer is caused by the HPV virus, and you do have the HPV vaccine in the market, whichever one you want to choose, which can help you prevent cervical cancer if taken at the right time, right dosage, right everything, to a very large extent. Saying that, a pap smear that we just spoke about earlier can detect cervical cancer much before it actually can hit you. So I can have certain changes telling me that this woman could get cervical cancer in the future. So I, as her, physician, am more aware. I keep her more aware. We do certain extra tests. So cervical cancer can be detected, prevented, and hence it's better.
Coming back to cervical cancer, there are vaccines available.
True.
Lot of people are saying, I mean, at least my gynec told me that you should take your vaccine when you are actually on your periods. How true it is that it should be taken while you are on your periods? And what difference does it make?
Very frankly, to the best of my knowledge, it really doesn't matter.
It doesn't.
Okay. You should take the vaccine.
Irrespective.
Period.
Okay.
You should. Okay. You take it on your periods, you take it after your periods. It's fine.
Fine. Okay.
But take the vaccine.
And also, there are many variants available in the
Absolutely.
vaccine. If you could tell me more on that.
So there are a lot of companies which have come out with the vaccine. There was the most talked about vaccine today is Gardasil 9, right? So what Gardasil 9 has is it has protection against 9 variants of the virus which can cause cancer. Gardasil 9 is entered the market. Has entered the market recently. Recently means around 3-4 years back, if I'm not wrong. And it is one of the best vaccines to take. Yes, it is expensive, but it is not bad. You do have other brands also which are in the market. You have the Indian brand now, Cervarix, which is in the market. Whatever suits you, whatever you understand about the vaccine, what your physician or your gynec can tell you about the vaccine, and whatever matches your whole concept is fine, but take the vaccine.
Take the vaccine.
Because it does protect you. The earlier you take the vaccine, the higher the protection level.
Okay.
So we do say that we give the vaccine between the ages of 10 to 45. The earlier you take it, like before 16, that vaccine is only in 2 doses.
Okay.
After 16, you're going to have 3 doses of the vaccine. But take it. There is no downside to taking the vaccine.
And there is no any as such research that it will do anything bad to you, because I think
it's been around for years.
But there is no more,
Gardasil 9 has entered now, but
Okay.
Gardasil 4, Gardasil 6 has been there for years. We all have taken it.
Okay.
Right? Vaccines have been there all for everything. Like right now, a BCG or a polio vaccine, you have to give it to your kid. You have no choice. It's a part of the schedule. The government is trying to get the HPV vaccine also part of the schedule. If it does happen, then great. We are also saying to give the vaccine to the boys, because the logic is it's not a cervical cancer vaccine, it's an HPV vaccine.
HPV vaccine.
And HPV as a virus can cause cervical cancer, can cause penile cancers, can cause anal cancers, can cause HFN cancers, that is head, face, neck cancers of certain kinds. So by taking the vaccine, you're actually preventing yourself to the best of its ability against all these cancers. So why only women?
Okay, correct. Men's
Boy-
are
men too,
important.
boys
yeah,
too.
boys too.
Boys
And I think when they start, it should start for boys and girls.
It has. In
Okay.
certain schools and stuff, they already have started propagating it, but boys and girls, yes.
I had a very wage discussion this with my friends and who are a little elder to me, and they just shoo me away like, we don't need this vaccine. And
because
that-
it's an option, right?
Yeah.
So whenever you give an option to somebody कि आप ले सकते हो या नहीं ले सकते, it's you have so much content out there which is pro and against the
Correct.
vaccine, like pro and against a lot of things in the market. right? There is always a good, there is always a bad. But like you always say, you weigh the pros against the cons. It is better to take the vaccine.
Okay.